Hi guys, it's Jackie with Innocent Armor. I'm here with Dr. Frank Wang today, and he's going to answer some questions that we have regarding coronavirus and a whole bunch of other questions that we've been getting. So thank you for joining us today.
My pleasure.
So tell us a little bit about your background and what your specialty is.
Sure. So I'm an internal medicine specialist, which is also known as primary care. We deal with adult patients in a variety of all types of diseases and disease processes. So this is something, and obviously a very serious and new thing for all of us, and we're learning as we go.
And how has this changed the way that you do daily business?
It has turned medicine upside down, essentially. As part of what they call de-densifying, which means to try to lower how many people are in a certain area. We've essentially closed our offices, as most physician practices have, to all elective care. So if you were to come in for a 3-month checkup for your diabetes, hypertension, or come in for a routine physical, all of those appointments have been canceled. And our practice has about a dozen primary care physicians. And right now we all go in once every 2 weeks to see patients, and all just for urgent issues that can't wait.
Wow.
So it's changed both our office practice, but then, many people are like, well, then what do you do? And so we have rapidly started telemedicine, and we also use a Zoom platform, a little bit different than the platform that you may be using, but we use one that is sort of HIPAA compliant, meaning that it protects the privacy of our patients.
That's fantastic. Is that something that you see continuing after this sort of gets a little bit better?
Yes. I think so. I think many patients have appreciated the convenience of it. It cuts down on I think, interruptions of their normal busy lives. For some of our elderly patients that may be able to check their blood pressures at home, we can do these visits online. I think it saves them the trouble of having to come in. And then again, for people who have jobs, I think it's much easier to carve out 30 minutes than it might be to carve out, a couple hours out of your day.
Absolutely. So I keep hearing the phrase herd immunity. What does that mean exactly?
Yeah, so herd immunity, so I should preface all of these comments on is sort of the things that all the medical specialists are learning about. Dr. Fauci, Dr. Birx from the White House physician. I mean, all of this is new to all of us as well. So many of the things that I may be saying may either hold true or they may not, but it's sort of, the best knowledge that we have at this time, just because, again, this is something that the human race has never seen before. So we're all going on untreaded territory here. So herd immunity means essentially when the disease prevalence and the penetrance of the disease has reached the herd, which is the human population. So there are a couple ways to think about this type of infection. Since nobody's ever had it before, one route, which the whole world did not take, is to just allow everybody to get infected. Because once everybody's infected, the disease itself cannot sort of persist. It can't cause a pandemic again. So the herd immunity just refers to the population, a certain percentage of the population will then have the infection, and therefore the disease will not be as severe going forth once everyone has immunity.
That makes sense. And so can you clarify, can you get it more than once?
Again, we don't know. We don't know. There are 2 strains, an L strain and an S strain. But again, we just don't know, the differences between the strains, because it's just such a new and novel infection that we just don't have any experience.
Right. Can you tell me how effective has social distancing been?
Yeah, I think, again, I think it's been very effective. We've seen New York City, they've flattened the curve. They've had some pretty draconian measures, as have many parts of the country, including, in the Boston area, including Boston here. It's disrupted, it's disrupted everybody's lives, but social distancing works because as long as you can't get infected, you therefore can't infect others. And
Right.
hopefully, again, the disease itself will just then be limited to the people that have the infection at that time.
Right. And aside from staying at home, what, if anything, can people do to protect themselves and their families?
Yeah, great question. Everything that the CDC, so that's short for the Centers for Disease Control, has said, washing your hands, covering a cough, staying home, isolation if you're sick, all of these things do work. And, it's a combination of being smart about avoiding crowds and, staying at home. And also, so if you do need to go out, to keep a safe distance from everyone else. And all the supermarkets that you go to now, they limit how many people can go in. They have one-way sort of aisles so that you can only proceed through the store in one direction, so that you're not going to run into somebody that may be coming head on. So again, they're promoting all of these social distancing, and then just very good hand hygiene. The
And
carts
then,
are all wiped down. When you
yeah,
enter the supermarkets, hand sanitizer, as you know, is very difficult to find.
absolutely. And I know here in Seattle, they've done a really good job of keeping things very sanitized and clean when going out. But how effective is wearing gloves and like a face protectant?
Again, it's better probably than nothing, but it's not perfect because we know the portal of entry is not just, it's any part of your face, including possible eyes, your nose, your mouth. These are the ways that viruses, not just coronavirus, but other viruses have portals of entry. So, you can cover up as much as you can, but it's still impossible, or not impossible, but very difficult, I think, to 100% prevent getting infected.
Right. And does it matter what kind of face covering you have? So we spoke to former survivor contestant, as well as she was also a Santa Monica police officer who had a suggestion for us last week to take, she had her survivor buff that she covered her face with, and she took a coffee filter, and she said she put the coffee filter inside of that buff just as an added extra layer of protection. Do you think that's a good idea, or does that seem silly to do?
Again, the science behind this is still emerging. I mean, we have two major health organizations that have different recommendations. So here in the United States, the Centers for Disease Control in Atlanta does recommend face coverings for when you go out, whether that's a surgical mask, and we should make the difference. We should make the distinction that that surgical mask is different than the N95 respirators that healthcare workers require when as personal protective equipment. So the CDC does recommend face covering. It can be of any sort, a bandana, a scarf. The World Health Organization does not. They do not recommend wearing a mask unless you're sick. So, these are two of the leading world sort of expert medical groups that, they don't even have, there's not even consensus. Part of it too is I think, in the US and other countries, they're a little bit worried about people buying the respirators, the N95 respirators, and they're leaving perhaps the healthcare sort of workers short of the personal protective equipment. So in terms of answering your question, it's hard to say. I don't have any science that says it's not effective. However, I can't say that most of these masks are tested by government agencies to what size particles that they can sort of filter out. And again, I think because we know that you can also, any mucous membrane, which includes your eyes, so any wet surface, your eyes, your nasal passages, as well as your mouth, can be portals of entry. A mask, even worn properly, even if it's an N95, may not protect you. So for the survivor buff with the coffee filter in the middle, is probably, again, probably better than nothing, and perhaps better than just wearing the buff. But again, the science is lacking. It's not been studied.
Well, have you seen a shortage in supplies in your community for our first responders, our doctors, our nurses?
Sure. Yeah, it's everywhere. I think, fortunately, the communities are pulling together. Um, the Boston area, thanks to the New England Patriots and Bob Kraft, we're able to get N95 respirators from China and donated 300,000 into New York City. So there's been a lot of community efforts, but the shortages still continue. Um, the big shortage for us in the Boston area now is not so much the availability of testing, but actually the nasal pharyngeal swabs that are required to actually do the test. Those are in very, very short supply. So we're almost having to ration off who we test. So it's been a very challenging time, and it's challenging for everybody, all the patients, but it's also been challenging to be sort of a healthcare provider at this time as well.
Absolutely. I can't imagine. And we really appreciate you.
Yeah. Thank you.
So, what questions are you getting asked most by patients or just, the community?
I think at the beginning there was a lot, not that at the very beginning, I think there was a lot of panic because there's so many things that were uncertain. And now I think at least we know some things about the virus. So at the beginning, it was mostly, if I have a runny nose, people were calling, can I get tested? I have this, can I get tested? But fortunately, I think as this is evolving, people are watching the news, watching Dr. Fauci, the medical experts talk about this, and they're learning a lot. So that I think now that they have some knowledge and they can make better sort of decisions about what questions and what things to ask us. As I think as we move forward, these are going to be the challenges. We really don't know. Number one, I think there are limits to testing, both the availability to test, but also there's been published reports that there's a pretty high percentage of false negatives. So if you test somebody that has COVID-19, up to 30% may be testing falsely negative, which is obviously a major issue, because if you think a patient clinically has COVID-19, you test is negative, most doctors and healthcare workers are still saying, well, this person still has COVID-19, but the test is negative. So the testing itself has to be a little bit better. We need better data on that. And then as the country starts thinking about sort of reopening, I think there needs to be sort of better, or at least a standardized serological testing to look for antibodies to test people who are immune.
Right.
Yeah, emerging data, emerging science. There was a study that was published from China that suggested that there are many people who still did not mount an antibody response, even though they had a positive COVID-19 test. So, again, we're all kind of figuring this out as we go and just making sort of the best educated guesses that we can.
And you said that, in the beginning, you would get calls from patients saying, oh, I have a sniffle, can I get a test? What are some of the telltale symptoms? I seem to have a constant sniffle because I have young kids in the house. And so I'm one of those people too. Do I have it? I don't know. So tell us a little bit more about, what.
Sure. I mean, the classic cases, of course, it's a flu-like illness. So onset of headache, fever, and shortness of breath has been the big one as well. But, again, I think as we're finding out, there are many people who have very much milder symptoms. And more interestingly, some people have no symptoms whatsoever.
Wow.
And positive. I think the most recent sort of highly publicized cases, George Stephanopoulos of ABC News in Good Morning America, his wife was diagnosed with COVID-19, and he has stated that he's been completely asymptomatic, yet tested positive for COVID-19. So the wide spectrum of disease is making this incredibly challenging. There are others that just have very, very minimal symptoms of a slight cough, but the classic sort of description of symptoms would be fever, cough, and shortness of breath.
Okay. And in your opinion, do you see an end in sight anytime soon?
I'm no smarter than those guys in Washington, but boy, I tell you, no, I don't. I think in some respects, thinking about the people who are asymptomatic, who have been infected, is one scary thought, that maybe a lot of people who are walking around feeling perfectly well, being very responsible, had the infection, is a very scary and sobering thought. On the other hand, thinking positive and put the positive spin on it, perhaps that means that herd immunity is actually closer than we think. Perhaps a higher percentage of people who we know and have diagnosed with COVID-19 have antibodies. So these things are all sort of things that are being worked on and will be looked at very carefully. And these are going to really, the science sort of that will guide sort of the decisions that are made in the future about reopening up segments of the population in our society here in the United States and in the world.
Right. And do you think that as the weather gets warmer, we'll see it kind of die down and then maybe come back again in the fall? Is that the speculation?
Yeah, it's all speculation. Everyone's guessing because, again, it's just like, there's, the other couple of viral infections that were, similar, SARS and then MERS. And, they all behave differently. It's all sort of guesswork. We can hope that it gets better as the weather warms up, but I don't think that anybody is really counting on that to happen.
Mm. Well, Dr. Wang, I want to thank you so much for everything that you're doing for your patients, for the community, and for being with us today and answering these tough questions. And I just want to ask one last question. Do you have any advice that you would give our viewers?
Just follow the recommendations of the experts. Stay at home. Wash your hands. Do all of those things because they are flattening the curve. We're seeing evidence of that happening both in your area in Seattle, in Kings County, but also in New York, really the epicenter in the United States. And things have been working exceedingly well from what we can tell in California. So listen to the experts, practice social distancing, stay at home, and hygiene.
Wonderful. Thank you so much again for your time.
You're very welcome. Have a good night.
You too. Bye-bye.